If you're over 60, I need to warn you with something most men never hear. It's not age that silently destroys erections, it's the everyday habits you overlook. One wrong choice repeated year after year can rob you of intimacy, confidence, and even signal deeper health problems like heart disease and stroke. I've seen men lose their vitality not because their bodies gave up, but because they ignored the signs until it was too late. My name is Dr. Mohit Khera. I'm a board-certified urologist with more than 30 years of experience treating men just like you. I've sat across from thousands of patients in their 60s, 70s, and 80s who thought their best years were behind them until we made the right changes. What I share with you today comes from decades of science and the real stories of men who regained their strength. Here's the surprising truth. The very things many men do to feel stronger or protect their masculinity, like pushing themselves too hard, keeping quiet about symptoms, or chasing risky fixes, are the exact things that quietly destroy erections. What looks harmless at first often turns into the reason intimacy fades. That's why this video is so important. I'm going to reveal the 10 things you should never do to your penis. These aren't myths or internet tricks. They are science-based warnings that, if ignored, can ruin both your erections and your long-term health. And I promise, if you stay with me until the end, you'll not only know what to avoid, but you'll also understand how to protect your erections for life. Because some of these dangers are closer than you think. Before we get started, take a moment to subscribe and turn on the notification bell so you never miss important advice designed to protect your health and vitality. And let me know you're here. Type 1 in the comments if this message speaks to you, or type 0 if you think I can serve you better. Now let's begin with the very first and most critical point, because it sets the foundation for everything else. The biggest mistake men make is ignoring the early changes in their erections. What may seem like a small shift today can be the first warning sign of serious problems tomorrow. 1. Ignoring changes in your penis. One of the greatest mistakes I see, over and over, is when men ignore the subtle changes in their erections. I can't count the number of times a patient has told me, "Doc, I thought it was just getting older." But here's the truth. When your morning erections begin to fade, when it takes more effort to get aroused, or when sensitivity feels different than before, those aren't meaningless quirks of age. They're signals. They're your body's way of whispering that something deeper is happening with your circulation, your nerves, or even your hormones. I remember a man in his late 60s who came into my office only after years of decline. He told me he wished he had paid attention earlier, because by the time he sought help, his erections were almost completely gone, and along with them, a big part of his confidence. It's not just about physical intimacy, it's about how you feel as a man, how you connect with your partner, and how you carry yourself every day. Ignoring these early changes not only risks your sexual health, but can also point to hidden dangers like heart disease or diabetes. That's why I urge you, don't wait. If something feels off for more than a few weeks, speak to your doctor. Early action can save years of frustration and restore the vitality you thought was slipping away. Now, if ignoring changes is the silent mistake most men make, the next danger is far more visible, and yet men fall for it every day. It's the trap of turning to risky home remedies, the kind that promise quick fixes but often leave lasting damage. 2. Falling for dangerous home remedies. I wish I could tell you how many men I've seen walk into my office with injuries that never should have happened, all because they trusted something they found online or heard from a friend. I remember one gentleman in his 70s who tried applying apple cider vinegar directly to his skin because he read it would increase blood flow. Instead, he came in with painful burns that left him scarred for months. Another man had built a crude device out of metal rings, convinced it would make him last longer. What it really did was cut off his circulation so badly that he needed emergency care. These stories are heartbreaking because they come from a place of desperation. Men who feel they are losing part of themselves and will try anything to get it back. I understand that fear. I understand the shame that can creep in when you feel your body is changing, but I need you to hear me clearly. These so-called remedies are not solutions. They are traps. They damage nerves, create scar tissue, and in some cases, cause permanent erectile dysfunction. And the worst part is, many of these men already had what they needed to turn things around. science-backed treatments, safe medical devices, and lifestyle changes that actually work. You don't have to gamble with your health or risk permanent harm to reclaim your confidence. If falling for dangerous remedies is one of the most reckless mistakes men make, then neglecting something as simple as daily hygiene might be the most overlooked, and yet it can quietly destroy not just your erections, but your dignity. 3. Neglecting hygiene. It might surprise you, but one of the simplest, most basic habits is also one of the most commonly overlooked: hygiene. I've met men in their 60s and 70s who told me, "Doc, I never thought cleaning down there really mattered." But the truth is, neglecting your hygiene can slowly chip away at both your health and your confidence. For men who are uncircumcised, failing to gently pull back the foreskin and clean underneath allows bacteria, sweat, and dead skin cells to build up. This buildup can lead to infections, inflammation, and in rare cases, even increase the risk of cancer. I remember one patient who admitted he avoided intimacy altogether because he was embarrassed about odor and discomfort. He thought it was just a part of aging, but after simple guidance on proper care, his confidence and his relationship changed almost overnight. Hygiene is not about vanity. It's about respect for yourself, your partner, and the body that has carried you this far. The fix doesn't require anything fancy, just gentle daily cleaning with mild soap and water. No harsh scrubbing, no strong fragrances. Think of it the same way you think about brushing your teeth, a small daily habit that prevents big problems down the road. And let me tell you, the relief and freedom that come from feeling clean, confident, and comfortable are priceless. Now, while poor hygiene can quietly erode your health and intimacy, there are other warning signs that are impossible to ignore, and yet too many men still do. Pain, bleeding, or unexpected lumps should never be brushed aside, because they may be the body's loudest cry for help. 4. Ignoring pain, bleeding, or lumps. One of the hardest conversations I have with men is when they finally come to me after months, sometimes years, of ignoring symptoms that should never have been brushed aside. Your penis should not hurt. You should not see blood in your urine. You should not feel a lump or a sore spot and tell yourself, "It's probably nothing." These are not the normal signs of getting older. These are red flags. I once had a patient in his late 60s who noticed blood but kept quiet, convinced it would just go away. By the time he walked into my office, what could have been treated quickly had become a much bigger challenge. I tell you this not to scare you, but because I care enough to be direct. Pain, bleeding, or lumps can signal infections, kidney stones, or in the worst cases, cancer. The longer you wait, the more dangerous it becomes. And beyond the physical risks, carrying that silent worry eats away at you emotionally. I've seen men lose sleep, avoid intimacy, and carry fear in silence because they were too embarrassed to speak up. But strength is not silence. Strength is listening to your body and taking action when something is wrong. If something feels off, even slightly, don't delay. Get it checked. It could save your health, your confidence, and your future. And while ignoring pain or bleeding can put your health at serious risk, there's another danger that can strike in an instant. A single careless moment in the bedroom that can leave permanent damage if you're not careful. 5. Losing control during sex. This may sound surprising, but one of the most devastating injuries I've treated in my career is something many men don't even know is possible: a penile fracture. Yes, it's real, and it happens when passion turns careless. Picture this: an erect penis suddenly bends in the wrong direction, and in that instant, the tissue can rupture. The man often hears a pop, followed by sharp pain and swelling that sets in quickly. I'll never forget a patient who came into the emergency room, his face pale with fear, because in one unguarded moment, his life changed. He needed surgery, and though we repaired the damage, he told me the emotional scar lasted far longer than the physical one. Intimacy after that carried a shadow of fear. And that's what I want you to avoid, because while sex should be passionate, it should also be mindful. Losing yourself completely in the moment without awareness can lead to mistakes that take months, even years to heal. The solution is not complicated. Use lubrication generously, stay present with your partner, and remember that intimacy is not about frantic speed or proving something. It's about connection, closeness, and trust. your erections, your confidence, and your future are worth slowing down for. And while losing control in the bedroom can cause sudden and dramatic harm, there are quieter habits, things you might do every single day without a second thought that slowly undermine your vitality. One of the most overlooked is the way men unintentionally overheat their testicles, not realizing the silent damage being done. 6. Overheating the testicles. There's a reason nature designed your testicles to hang outside of your body. They need to stay cooler than the rest of you in order to function properly. But over the years, I've seen countless men unknowingly sabotage themselves by exposing this delicate area to too much heat. Long soaks in hot tubs, endless hours in saunas, keeping a laptop on the lap, or even carrying a cell phone in a front pocket, all of these raise the temperature of the testicles more than they were ever meant to handle. I remember one man in his 70s who told me he loved spending time in his hot tub every evening. He thought it was harmless relaxation, but over time his energy dropped, his desire faded, and his testosterone levels tested lower than they had ever been. It was a painful realization that his nightly routine was slowly draining the very vitality he wanted to preserve. Heat doesn't just affect hormones, it can damage sperm quality, reduce testosterone, and chip away at stamina, leaving you feeling weaker, more irritable, and less alive. The fix is simple. Keep your testicles cool. Wear looser clothing, limit hot tub and sauna sessions, and never rest electronics on your lap for long stretches. Give your body the environment it was designed for, and you'll give yourself the best chance at maintaining strength and vitality for years to come. But while overheating quietly erodes your energy over time, another danger comes not from the outside world, but from the way you treat your own body. And it's a habit so common that most men don't realize it's dulling their pleasure and rewiring their brains. 7. Aggressive masturbation. This is a subject many men are embarrassed to talk about, but I want to be honest with you because I've seen the damage it can cause. Over the years, I've met countless patients who admitted they had developed what we call death grip syndrome. It happens when a man gets used to gripping too tightly or applying too much pressure during masturbation. At first, it feels powerful and satisfying, but slowly the body adapts. The nerves become less sensitive, the brain learns to only respond to that one type of stimulation, and intimacy with a partner no longer feels the same. I remember one man in his mid-60s who told me, with tears in his eyes, that he couldn't climax with his wife anymore. He thought he was broken, when in reality, his body had just been trained into a very narrow response. The frustration weighed heavily on him and on his marriage. But once he understood what was happening, he was able to make changes, slowing down, using lubrication, experimenting with lighter touches, and retraining his body to enjoy variety. Gentlemen, your body is adaptable, and that means you can heal, but it also means you need to be mindful of the patterns you create. Aggressive habits may give short-term satisfaction but long-term disappointment. Treat yourself with patience and respect, because pleasure should be something you share, not something that isolates you. And if aggressive habits can rewire your brain in ways that rob you of intimacy, there's another habit that does even worse. It attacks the very blood vessels that make erections possible, and it's something far too many men still cling to. 8. Smoking and poor lifestyle. If there is one habit I can tell you with absolute certainty that destroys erections faster than almost anything else, it's smoking. I've seen it countless times in men who thought cigarettes were just a small vice, something they could enjoy without real consequence. But smoking does its damage quietly and relentlessly, narrowing the very blood vessels that your erections depend on. I'll never forget a patient in his early 70s who came to see me after years of smoking. He told me he thought losing his erections was simply old age. When we ran tests, it was clear. His arteries were so damaged that blood could no longer flow properly. He wasn't just facing erectile dysfunction, he was at high risk for a heart attack. And smoking is only part of the story. Poor diet, too much alcohol, lack of exercise, constant stress, all of these form a perfect storm that robs a man of his vitality. What's heartbreaking is that these men often blame themselves, believing they're simply past their prime, when in truth, their lifestyle is stealing what could still be theirs. The encouraging news is that change makes a difference at any age. I've seen men quit smoking, start walking daily, eat better, and within months, feel energy and desire return that they thought was gone forever. Your erections are not separate from your health, they are a reflection of it. Protect your health, and your sexual vitality will follow. But while smoking and poor habits destroy your body from the inside out, there is another danger that works in silence, inside your own mind, and it can crush intimacy even when your body is still capable. 9. Beating yourself up for off nights. One of the most painful patterns I see in men is not a physical problem at all. It's the way they treat themselves after an off night. Every man, no matter his age, will have moments when things don't go as planned. Maybe stress is high, maybe you're tired, maybe your mind just isn't in the right place. But instead of brushing it off, many men turn it into a personal judgment, telling themselves they failed, that they're no longer a man, that intimacy is slipping away forever. I remember a man in his late 60s who broke down in my office after avoiding his wife for months. One disappointing night had turned into a spiral of self-doubt. He was so afraid of it happening again that he stopped trying altogether. What he didn't realize was that his own stress and shame were shutting down his body's natural response. Cortisol, the stress hormone, is like kryptonite to erections. The more you criticize yourself, the harder intimacy becomes. What I told him, and what I want to tell you, is that one imperfect night does not define you. Your partner cares far more about closeness, trust, and affection than about a single performance. When you show yourself compassion, when you talk openly instead of withdrawing, you give yourself the chance to break the cycle. Remember, intimacy is about connection, not perfection. And while being too hard on yourself can quietly sabotage your confidence, there's one final mistake that men make which is even more dangerous, because if you stop using your erections altogether, you risk losing them for good. 10. Not using it. Use it or lose it. One of the most important truths I can share with you is this. Erections are like any other part of your body. If you stop using them, you risk losing them. Over the years, I've seen men slowly drift away from intimacy, either because of embarrassment, fear of failure, or the belief that sex is only for the young. They convince themselves that avoiding it is easier, but what they don't realize is that this very avoidance is causing the problem to grow worse. Erections depend on healthy blood flow and regular stimulation to keep the tissue strong and responsive. Without that circulation, scar tissue can form, shrinkage can occur, and sensitivity fades over time. I remember a man in his 70s who confessed that he hadn't been intimate in years. When he finally wanted to reconnect with his partner, his body no longer responded the way it once did, and the heartbreak in his eyes was something I'll never forget. Intimacy is not only about sex, it's about touch, closeness, and the confidence that comes from feeling alive as a man. Even gentle stimulation, whether alone or with a partner, helps keep the system working. Don't let shame or fear rob you of something so vital to your health and happiness. Keep showing your body that it matters, because it does. And as we close, I want to leave you with this. Needing to change your habits doesn't mean you're broken. It means you're wise enough to protect yourself. Confidence, connection, and dignity don't fade with age. They grow with care. Your future can still be full of strength and intimacy if you choose to honor your body today.